Good afternoon, everybody. Today's February 5th, 2021. My name's Scott McGann with the Falmouth Health Department. We're doing our weekly COVID update. FalmouthMass.us, actually, it should be FalmouthMA.gov, and we switched it over, but I'll get you there anyway. But FalmouthMA.gov is where you can get all your COVID resources, plus the links to the state websites for registering yourself for your vaccine and information on COVID. This presentation also goes on it. For non-registration purposes, you can email health@falmouthma.gov if you have, COVID compliance problems with a particular business, things of that nature, general COVID things, we can help you out. 508-495-7485 is the number. Again, non-vaccine related, if you had a problem, contact tracing questions primarily and complaints, that's where I'd like you to go. Also, there's the county COVID hotline at 774-330-3001. That has been real busy. It's averaging over 2,000 calls per day. They are training more staff, but so that's also a non-registration COVID hotline. So the governor, this is the second presentation, the governor has changed it around a little bit and moved up the dates a bit based on what the DPH was telling us, Department of Public Health. So we're in currently the individuals over 75, and we've begun phase 2. Unfortunately, there's not a lot of vaccines, and so there's been a lot of frustration over the last week, and understandably. So my next slide hopefully clears it. The next few slides might clear a few things up for you. Again, you must register for an appointment online through the state system. Okay, so the state system, and you can get through it. It's through the state. Where do I get my vaccine? It's also massimmunizations.org, and I have a couple slides on that. And when you register yourself offsite, the problem's been is there hasn't been any place to register for the most part, is because vaccines in very short supply, and it's going to remain in short supply for the next few weeks. So there's been only 975 doses sent. This is for phase 2, not for phase 1. This was for cleaning up the rest of phase 1 and the beginning of phase 2, the 75 and older. 600 went to the Barnstable County Fairgrounds. That was done on Wednesday. Calling and asking to be put on a waiting list. There's a waiting list function on the website. We're not taking reservations at the health department or at the senior center or veteran services. But as the clinic that we'll talk about is ready to run more than just once in a blue moon. It's just that you need the vaccine in order to do it. And also, being 75 and older, not all of you can register on the computer. So there's the town. We're very shortly will have set up a local call-in for those who cannot register and are 75 and older. The state is also doing that. More to come on that as well. So you'll have a couple opportunities to be able to register yourself through the phone and have somebody help you by being on the website and registering for you. Again, Barnstable County's call line is really packed, so that's not for registering yourself, registering an appointment. So more to come. I'll have it in my presentation. And also, if you do know how to use the computer and you are checking our website, that information will be put up there when we're ready, when it's done and things are good to go. And so there's been a lot of confusion, and there's been a lot of demand, obviously, and not enough vaccine. So the confusion is that they're having trouble going through and seeing an appointment. And the reason being is, and let me go to the next slide here. The reason being is the clinics don't show openings if there aren't any openings. If there's no vaccine, there's no opening. So when the 600 appointments showed up on the website, they were gone in about an hour. And so there's not another clinic scheduled on it because there's no vaccine to put into the clinic. That's just the way the state is keeping they're really using most of the vaccines in areas of high infection, and also to support their high throughput clinics like the one at Gillette. That'd be the closest one at this point in time. So as more vaccine comes in, there'll be more of an active button or an active way to click on the different stars that are on this map and being able to find an appointment. So last week, the state hadn't even put up the gold star, the gold colored star for the fairgrounds, which is a regional. The colors coding are as follows. Large state-run sites are in red, so you can see the Gillette one at Foxborough. Local pharmacies, local clinics that are done at the private sector are shown up in blue. There'll be a lot more of those as time progresses. There'll be perhaps hopefully a closer state-run one as well. Green are general sites as well, and the gold-colored ones are those that are for a finite population. For example, are safe for Barnstable County residents only. And so we have those buttons. okay? And you can find it either by going on falmouthmass.gov or searching COVID-19 vaccinations at mass.gov or massimmunizations.org. The map here is the one that's on the one that's on the state's mass.gov vaccine locations. Okay, and this will be, the stars will come up, and you'll be able to go through it for each of the different stars. Now, the private ones will, if it's Walgreens, will go to the Walgreens website. CVS would go to the CVS site, and so on and so forth. The state ones take you to the place called PrepMod, and that's where the mass immunizations are, and then they show you all the clinics. So that's where you'll be able to get your vaccines as time progresses. Also, as more vaccine get in, right now we don't have enough to even staff the fairgrounds one, not staff, supply vaccine to the fairgrounds. There's no sense of trying to schedule other clinics on this and not have the vaccine. So 600 vaccines come in, 600 appointments. 2,000 vaccines come in over a few days, there'd be a few days worth of appointments. No vaccines come in for a month, you won't have ability to book a vaccine at the fairgrounds. It's just based on the number of vaccines that are being committed to us by the state. As more and more vaccines come in, you'll see the high school open up. So as we're running the fairgrounds and we have more vaccines than the fairgrounds can handle, then we'll bring vaccines to the high school, do a clinic at either the high school or it could be the Gus Candy, depends on the amount. You can do more out of the high school. And it depends on how many we get. So as vaccines come in and we get more of them, we can have more and more sites open. It's just having it, you register now for a site, let's say, for example, March 15th at the high school makes no sense. I don't know if I'll have vaccine on March 15th. So you don't see a lot in there because there's just not a lot of vaccine. So having the one site at the fairgrounds, when vaccines come up, to have it there, one site only makes sense because there's just not enough vaccines to have a second. Also, if you're homebound, we are working on ways of getting to you. Also, the different the senior housings and things like that. So a lot of things are moving. Again, but there just isn't vaccines to really do much with at this point. Going on to the next slide. So when you go and click on this gold star, the next one to come up would come up something like this. And on the side, it would say, this is the website you click on. You would click on the massimmunizations.org. All right, it says eligible populations, Barnstable County, the address, it's a drive-through. And we go on that way. But when you come to it, it would show up like this. You would click on Falmouth. This is the massimmunizations.org, Falmouth Mass, vaccinations, click on seniors and adults, search in Falmouth, and the fairgrounds comes up. And then you would click on there to sign up. Now, if you went on there today, it's going to look like this, where here's the same site, but it's only showing Gillette. Well, it's because there's no vaccines available for the fairgrounds. So that, I guess what the state does, and again, I don't have control over this, is that'll click on and click off as the vaccines become available. So what you have to do is treat this like you're getting Rolling Stones tickets or Taylor Swift, depending on your age, and you're trying to get on to get tickets for something, that you do need to go on here quite often. There's a wait list function as well. You can do that as you see them. We do call up the wait list. You can do that, but I'd still want you to actively search instead of waiting passively for a wait list to call you up, is to continue to search and find and jump on. And again, there'll be a lot more opportunities. I know Gillette just got a bunch of doses today. I've heard, no special notification per se, but I heard that they got a bunch of doses. Well, actually, I did get a notification this morning. Sorry, check that. I did get a notification that they were going to have some at the Gillette. And so you have to check it every day and jump on the Gillette. And then if you see one at the fairgrounds, because for some reason we got 2,000 doses, you'll see a bunch of appointments come in. So again, it's really frustrating at the beginning. So I think what you want to do is just to make sure you know how to use the system, so when the time comes, you can jump on one. And again, as time progresses, there'll be lots more vaccines and lot more appointments. So that's it for the registration part. This is what the fairground site looked like. You'd come in on Courier Road, you go down and get checked in. There'll be a few lines of people stacked up. We had a lot of early birds come in a couple hours early, so obviously the nurses hadn't even been close to setting up at 8 o'clock in the morning, and so we already had a lot of lines. So once that line is full, as people come in for the regular appointment, you never get through that line, so it's really hard. So you really should try to show up close to your time. Showing up 2 hours early only makes it harder. It doesn't make it necessarily easier. And then when you do, those that do show up on time end up having to wait a while. So that's just, if you got an appointment for 10:18, you should be coming close to 10:18 instead of coming up at 8:18. because it just makes it a lot more difficult to run a clinic. If you heard, we did have some issues with we had thawing over the week. It was warmer this week than last week, plus a lot of rain on Monday. Made it very soft over on that little entrance to get in over here right before it, and we'll fix that up by the next one. And then you have, what we had was 6 nurse stations, 3 rows of 2 nurses, two stacked. It had about 3 minutes a car. Once you get in there, it takes about 3 minutes to get you shot and out. Then you come down here and we hold you for 15 to 30 minutes, depending whether you had allergies or not. And then you come out, if you've had an anaphylactic shock before, we'll have you hold for 30, otherwise 15 minutes. We do have some medical staff there. We have an EMS person there, not a trained, but we do have a trained person there right now with with the EpiPens and things that he would need, or she would need. You come out the gate, and either if you're Bourne or Falmouth, you take a left. If you're Mashpee or Hyannis, you take a right. And it worked fairly well. We got through everybody in about 5 hours, a little over about 600 doses, so it was a fairly good run. We have a few things to tweak and some signs to move, but it worked pretty well. And that'll be our primary site for the region, the Upper Cape. It's really available to any Barnstable County residents. What's happening now is you've got 4 of these sites. You've got one at, I also want to mention, you also have the Four Seas site, which is the same thing run by the county. You have one in Orleans, and there's going to be one down Cape. They're still setting up now at one of the Outer Cape beaches, I believe. And then the vaccine, when it's really in light, like we got 2/3 of the doses this week, that the doses will move, if we only get the same amount, will move down Cape for that following week. But as vaccines come in, we could run all 4 sites simultaneously. That would be great, but we're going to be a little while before we run them simultaneously. It looks like Wednesdays will be the day here, and it may not be every week. It might be until vaccines come in. When they come in, we run them more often. And so that's, we've got enough nursing staff to run all 4. It's just a matter of having enough vaccine. As far as cases, so that's what I have to talk about vaccine. As far as cases, we're at 1094, so 1,094 cases since March of last year, 162 probables since the 1st. There have been 47 confirmed cases over the past week. I do it from Thursday to Thursday, so that's down almost half, 40-something% from the week before. Less than 7% of cases are no longer in isolation. We're always hovering around 12% of total cases in the county. We're 14 of population, so we've done slightly better than the county. Of course, the VNA and the CTC and the health department, we keep doing the contact tracing like we have always done all along. We haven't changed anything with that. Number of cases per week, you can see that we've had a good trend. 3 weeks ago, we had the highest number we've had before of 110. That had dropped out into the 80s the previous week, and we're at 47 this week, so that is a good trend. That's in the right direction. Hopefully we can keep it down and get it under the 30 and down to 20. We do have some February vacations coming up at school and the Super Bowl, and we do need to keep keep battling the battle here. So we may still have another little possible blip, increase due to either the Super Bowl or February vacation. But if not, the trend continues, then we're in a good direction. Again, you start seeing a slight flattening here just because the cases are starting to go down, but we're still in a very upward trajectory as far as cases here. Again, whether we are yellow or red, state metrics, yellow or red, we're well over 43 cases in 2 weeks. So it's really about the positivity being greater than or less than 5%, whether we're going to go yellow or red. So we had 2 consecutive weeks in red, and we've gone yellow because we're in a lower trend. We went from 5.5% positivity down to 4%, 4.07, which is a full 1.5%. That's great. And so it's brought us back into yellow. With 133, with a case count of 133 over that time frame, 2-week time frame. Total number of cases at 150. Our tests were 3,682, with a total test in Falmouth of 44,559. The county-wide, we're doing better than the county, and also better than the state, which is typical for us. We usually do. And this data comes up as current as 2/2. That's when the state pulls these reports and it stops the counting at that date. So 2/2/21. The county's also shown it a little bit better than before. They're at 8,920 confirmed cases with 531 probables. The numbers are a bit better Still high, but a bit better, more towards where we were in December. So January seems to have been our worst month out of the last December, January, February time. Well, February you can't really count, but January is definitely worse than December. As far as state numbers just show that everything is on a downward trend. 2,000 cases, we were well above 5 on a lot of days. It's still averaging between 80 and 110,000 tests per day. Hospitalizations are under 2,000. They're at the 1,500 range. They were well over 2,000 for a while. ICU is all better. The percent positivity, that was up in that 6 or 7 range, is overall at 3.29. The deaths are still high, but they tend to be a metric that takes a while to come down from a peak number of cases. People end up spending a long time in the hospital before it happens, unfortunately. The turnaround time for the molecular test is under 2 days. So we're all in a good trend. You can see it in the graphs I show you next. It shows everything on a downward trend, which is great, and hopefully continues. Hospitalizations, Falmouth Hospital the last time, 2-3, so Wednesday was 7 hospital beds, 5 ICU. Cape Cod was 8 with 12 in the ICU. So better than, let's say, mid to late January, still on the high side, but getting better, indicating, which makes sense with the cases going down. Testing hasn't changed. You can still, the fairgrounds is switched over to a test site. There's no charge on that one if you can get an appointment. Also, pharmacies like the community, but the drive-through is not run every day. It's just run maybe on I think once or twice a week. You still book an appointment. There's the phone number there. You book an appointment through your primary at this one. If you don't have a primary, you can call this testing line at 534-7103. You still have the hospital through Cape Cod Healthcare. Nothing's different there. Also the pharmacies, the Community Health Center of Cape Cod, the walk-in clinics. If you want a rapid test, I know that Convenient MD is doing the rapid test. Most of these places are PCR tests. Rapids are quicker, just not quite as accurate, but quick. Again, social distancing, all the same things still apply. Okay, the state has relaxed some of the 25% capacity has been relaxed to 40%. I didn't put a slide on it, but you can go to the state site if you're a business and look at that if your business has changed capacity. Again, it's all the same stuff. We got holidays. We got the Super Bowl this weekend. It's just being smart about what you're doing and help to keep the numbers down. So to recap, the state metrics remain high, but are definitely down. But still on the high side. Falmouth cases dipped below 50 cases a week this week, and we did go back to yellow. Definitely can still get, you can still get this, there's no doubt about it, so you need to make sure you do all the things that you need to do. And vaccine is being administered as it arrives, and so as the supply gets better, your ability to book an appointment on the computer gets better. And again, if you're sitting here listening to me and you have no computer and you have no ability and you're really scared, there will be some call lines set up that you'll be able to. And we'll get the information out to you. But yeah, that's that's where we're at, and things will get better as this, again, all we need is the vaccine. We can vaccinate a lot of people. We just have to have the vaccine to do it. And that's it for the recap, and thanks.